Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms, and every month we bring to you an important health topic that you need to know about with our friends and partners at UTMB Health. They are our preferred providers for the Bay Area, Galveston, League City, Pearland, and we highly encourage you to go in, check out all their resources. And this month we thought we would tackle some potty training. So if you have friends who have littles who might be entering into this stage of potty training, or if that's you, and you are going into this journey and just unsure of what it looks like, some of the challenges you may face, and you're really needing all the tips, we are here for those today. So today I have joining us is Dr. Hannah O'Donohoe, and she is a general pediatrician and practices out of the Galveston and League City area. Dr. O'Donohoe, thank you so much for joining us.
Yes, thanks for having me. I'm excited.
Absolutely. Can you tell us just a little bit about yourself and your practice?
Of course. So I actually was born and raised in Galveston, went to college in Houston at Rice, came right back to UTMB for medical school and residency, and I've been here ever since. I am a general outpatient pediatrician. I do clinic, regular well checks, sick visits, all of that. And then I also am part of the child abuse team at UTMB, and so I also run a clinic for kids in foster care.
Love it. Well, thank you so much for taking the time. I know you are a very busy woman and doctor, and we appreciate this because I know when I went through the whole potty training situation, and I had twins to potty train, I had no idea what I was doing. And so let's just kick it right off. What are some of your top tips for potty training? What ages should we start this? What should we be looking for? Let's just kick it right off.
Yeah, sure. And I understand. I have been there as a mom too. It is a rough time period, and probably also one of my most asked questions about in those toddler well visit ages. So usually what I say is, your body has to get ready with all the myelinization of nerves and all of that. Most kids would not be ready to do much until 18 months or so at the very earliest, and that's early. But, never too early to start going ahead talking about it. In that 15, 18-month age range, they are more aware that they are using the restroom. They might say, oh, I did something, they're aware of it. And so this is a great time to start talking about it. Yes, we all poop and we all pee, and that's what's happening. Get, books about it, sing songs about it, let them come in the bathroom with you and see how you handle those situations. Great time to go ahead and get the potty chair and start, getting them used to it. Even just having it around and seeing it over and over is helpful. Mm-hmm. So in that kind of 18-month to 2-year range is kind of where you're going to start ramping it up, talking about it again, over and over. You may have them start sitting on it with the diaper on first, just kind of get used to being on there. Then even jumping, the poop from the diaper into the toilet, talk about where it goes, that everything is normal and everything is okay. Some other things to look for if you want to kind of assess if your kid is ready is, besides them telling you that they did go, the big thing is, can they predict when they need to go, when they are about to go? Because if they can't really figure that out yet, probably not a good time to push the potty training. They need to be able to get over to the toilet. So, they need to be able to walk. They need to be able to pull their pants up and down. So that's something else you can kind of practice with them. Those are kind of the big things that we kind of look for. And so once they're kind of calling to your attention, oh, I think I need to go, then you take them over there. No major pressure, just keep it light and fun and easy. Make it a big deal. Success is great, play it up. Little prizes are fine. If you want to give them little prizes for peeing or pooping on the potty.
That was
Some
going to
good,
be a question.
yeah,
Yeah. So how do we feel about, I mean, quote unquote bribery? I remember M&Ms. Like that
yes,
was, my kids
yes,
would go for M&Ms.
yes. I think that that is fine. A little, something very small, especially if you're kind of running into some resistance, a little bit of small bribery is okay with me. I would save the big prizes for maybe if you get a little more resistance later on, or you want a big prize for the very end, but little, surprises here and there are okay. Sticker charts, even if you run into problems, that would be okay too. But yeah, and then some great times to kind of ensure success, or like right when they wake up, like almost everyone needs to go. So especially if they wake up and their diaper's pretty dry, that's a great time to just say, well, hey, let's just sit on the potty and see what happens. And usually is a good time that you can catch some early morning urination. And then another good time is, about 15-20 minutes after a meal. Usually we have this gastrocolic reflex. Your bowels start moving, and they usually have a bowel movement around that time. And that's another good time. Like, let's just sit and see what happens. And a lot of times it'll happen as they sit and they relax. So
Do you
those are some
have,
great times.
sorry to interrupt you. So what do you think about, is there like a cutoff time for like liquids before bedtime, where you may just want to like either, restrict after a certain time, or if you just make sure that they go before they go to bed?
Yeah, I wouldn't worry too much about restricting liquids. Nighttime training is kind of a whole nother thing that can
Yeah.
take a while, and that's okay. And unless you're running into problems where they're getting much older and still having nighttime accidents, I wouldn't restrict fluids. I do like the make sure they go to the potty right before bed. Sometimes I'll even suggest kind of like a double potty, like go once kind of towards the beginning of your bedtime routine and then go again right before you get in bed, or at least have them try. And sometimes that will help too.
What are your thoughts on like the 3-day methods and things that are, pretty intense? Like you're staying home and this is what's going to happen for 3 days. What do you think?
I think that that's fine. Every kid and every family is different. And I think you kind of have to look at all the options and see what you think you would be most comfortable with. Hey, I think it's worth a try, but I wouldn't be too discouraged if you weren't quite successful in the 3 days. But hey, I think it's a good kick off the potty training at least. Like, hey,
Yeah.
look, it's a good time. You're talking a lot about it. I do agree. I mean, having them run around naked with no diaper does take away some of the barriers to getting to the potty on time. So I think that it's fine. I just don't want people to be discouraged if it doesn't work in those exact 3 days. It doesn't necessarily mean anything is wrong with your kid or with you or anything like that.
No, we can put a lot of pressure on ourselves
Exactly.
for that. And I mentioned kind of at the top of the video that I had potty training twins, a boy and a girl.
Wow.
Do you notice a difference in readiness from boys to girls? Because I certainly did in my house, but I don't know how much of it was personality or gender.
Exactly. I feel like I hear those things. There's no like proven studies that boys versus girls are ready before the other. I think it's more of a personality type of thing.
Hmm.
Um, you know, I don't know what your experience was. I feel like I hear mostly that boys are harder, but I don't know. Like, there's no proven thing about it. I think it's just a personality thing.
It's so funny. We had like our own little social experiment in our house. And my daughter, as soon as she saw like big girl panties and she wanted to be so big, such a
Uh-huh.
big girl. I mean, that was all she needed, but that's
Yeah.
so much her personality. And then my son was like, I'm cool with just like, I mean, he didn't walk till he was like 14 months old. He was like, he was cool to just pee in his pants. Like
Yeah.
that was
Yeah.
okay with him. He's going to
Yeah.
be so mad that I said that, by the way.
Oh, that's
Um,
okay.
we won't let him watch this video.
Yeah.
Um, so beyond like, let's say we've done the things and we've tried all the tricks, we've read all the books, we've read all the things. When should a parent start being concerned about accidents and a child being unable to potty train?
Yeah. So theoretically, most children should be kind of have like adult pattern of, being able to use the bathroom around like 4 to 5 years old. I think a few of the kind of red flags, if you will, that I look for is a child who's older than that, especially reaching 5 and still, having quite a few accidents in the daytime. Nighttime is still, that's pretty normal, of course, to keep to still have some nighttime accidents, but daytime accidents that are pretty persistent at that age, I'd say, we might just want to make sure there's nothing else going on, or a regression, like a major regression, like, oh, they were doing so well, and then now all of a sudden, like nonstop, we're having accidents. And if they're pee accidents or poop accidents, you kind of think different things. So that, or if anytime there's, of course, things like it's painful when they're, peeing, or they're like consistently kind of like, I need to go right now. We call that urgency. That can be a kind of a red flag. Like, is there something else going on? Or they are having trouble even getting the urine out, or what we call like incomplete voiding, where they might go and then they have to go like right after again and again. Some of that can be behavioral with kids. They just don't take the time to sit and empty completely. But if it's kind of happening consistently over and over, that would be another concern. Some other red flags I look for are if they're like underwear or panties are wet, like seems like they're wet constantly, almost like a leakage. That would be something to look out for. Or even if they kind of have what we call like stress incontinence, like they laugh a lot and they leak urine. That's another that you might just be like, oh, they had another accident, but maybe there's something else that's causing it. So those are kind of some of the main things that I look for. Or they're, an increase in their urination, like, man, they just have to go nonstop. That's another kind of red flag that I would say, well, let's stop and think about this and make sure maybe there's nothing else going on.
So given those scenarios, because I think the things that you brought up, I'm thinking different things. Like I'm thinking kidney person and like, so who are you sending these children to? I mean, I'm assuming you're evaluating, you're being like, meh, like maybe we should see a specialist. And how do you determine that?
Right. So depending on the problem, a lot of times the first thing we do is we'll get a urine sample and take a look at that. Now, if I see maybe a sign of an infection, like urinary tract infection or cystitis, for the most part, I can take care of that. Now, if we keep having them over and over, then we'll send them to usually a nephrologist to make sure that there's nothing wrong anatomically with the kidneys or the bladder or where they're connected. So that would be the other thing. If the urine is not concentrating properly, or I see other little things that are probably related to like the bladder and kidney system, I would either use a urologist or a nephrologist. So they take care of kind of that whole area. And especially if it's like an anatomical thing on the outside of the skin, especially like a male, like if there's something wrong with where the urine's coming out, or then a urologist can help with that as well. Other things that I mentioned, even like the urgency or increase in urination, I mean, that can even be a sign of something like diabetes, which would be a whole nother thing, like an endocrinologist. So yeah, it kind of depends, but or even a neurologist might come into play at some point if we're, some of those can be signs of like spinal abnormalities or neurological issues, and then we'd need a PD neurologist. So yeah, there's kind of a lot of ways that can go, and a lot of specialists that we have that we can use to help us figure it out.
Well, and that's something that we talk about over and over again when we have these videos with UTMB, is that y'all have all of these people to refer out to. It's so much a comprehensive care. And so again, we continue to preach, make sure you're getting into your pediatrician, that you have a good established relationship with a pediatrician like yourself. And then that way those conversations can happen. And if we need to go see a specialist, the perfect person to send them to.
Yes.
And I think that's so, so important. I know we've kind of covered a little bit today, and there's so much that we could probably talk about for potty training, and I
Yeah.
could give you all the stories.
Yeah.
What else would you like to add as it relates to moms who maybe are in the trenches right now and they're like, this is never going to happen, or they like see their Facebook status from their friend who's like,
Yeah.
my 19-month-old, pee and poos in the potty.
Yeah. Oh gosh, I know. It is so hard. I know as moms, we are just so, so hard on ourselves. And we compare other kids. And I know that that's tempting to do, but try not to. Every child is different. And potty training is similar, just like walking and talking. Every kid kind of has their own timeline. And it doesn't mean they're not going to get there, but just hang in there. It's the 3-day method might work for some, it won't for another, and that is totally fine. They will both end up potty trained just like the other, So I think the big thing is, give yourself grace, hang in there. Probably the worst thing you can do for potty training is to get aggravated or like stressed about it, because the kids can feel that, and then it puts a lot of pressure on them. Even like the constant reminders, do you need to go potty? Do you need to go potty? Go sit on the potty. They will, some kids, given different personalities, will resist that. And it can cause, problems with the timeline of getting them potty trained.
That is such a great point, because I do think we put so much stress on ourselves. Like we must do this, or maybe you're trying to get your kid potty trained to go to preschool because they can't go to
Right.
preschool wearing a diaper or whatever. I do remember it being stressful in our house until I finally just threw up my hands and said, listen, I have a pretty good feeling the child is not going to college in diapers. So we will get there. I won't say which one, but I bet you can guess. And so, yes, great encouragement from you. I love that so, so much. I appreciate you joining us today. And for all of y'all who have been watching, I'm going to drop a couple of links that Houston Moms has done on potty training, a few different type of methods, one being a hands-off kind of method, which I favored. We have a 3-day method. And so we'll drop those in, as well as we will drop in links for how to find a pediatrician. If you are in need of a pediatrician, or you're looking for a relationship with a general petty, then we're going to put that there. So you can find it at UTMB Health. And next month, we will be back with another hot topic and things that you want to hear about. Thank you again so much for joining us, and we'll see you guys next month.